Hello, and welcome to the Alabama Public Health Training Network. I'm Brandon Vaughn with the Alabama Department of Public Health. Thank you for joining us today for our program, Tele-Behavioral Health, assessing patients and providers for FIT. If you have a question about anything being discussed today, please call or email during our broadcast. The phone number and email address are on your screen now and will appear again later in the program. Also, the handouts and evaluation are available online. You will need to register for this program in order to access those materials. Continuing education credits have been approved for nurses and social workers for this program. In order to receive credit for this training, you must watch the entire program, then complete and return the sign-in sheet and evaluation. While content may continue to be relevant, CE credit will only be awarded for 2 years for nurses and social workers expiring on November 30th, 2021. If you are watching this program on demand and want to receive a social work CE certificate, you will need to complete the social work test and send it in, along with your sign-in sheet and evaluation. If you are watching this program live, there is no social work test required. For social workers, if you're watching this program live, it qualifies for classroom hours. If you're watching on demand, it is considered non-classroom hours. Before we get started, I would like to introduce our presenter today, Elena M. Parker Merriweather, Director of Behavioral Health for Medical Advocacy and Outreach's Copeland Care Clinic. Welcome, Elena.
Thank you.
I know we have a lot of important information to cover today, so let's go ahead and get started with your presentation.
Well, thank you, Brandon. It's always good to be back today. I want to start off just kind of talking a little bit about our topic for today and give you our objectives for our program this afternoon. So what we're hoping to do is provide a general overview of the different clinical disciplines that actually use technology for the delivery of behavioral health services. We'll also discuss how to assess clinical providers as well as patients or clients for appropriateness and fit using various distance medians. We'll also talk a little bit about the programmatic and clinical considerations pertaining to risk management procedures when utilizing distance method medians for telebehavioral health services. So, as Brandon stated, this is part 2 of an initial program that we started on last month where we gave just a general overview of telebehavioral health. And so this is considered to be a series that builds upon the prior training that was done. So before we get into talking about our objectives for today, just kind of want to lay some groundwork and do a quick review of some of the information that we discussed at the prior training. And one thing that I do want to mention is that we want to just kind of challenge everyone who's viewing this program today to think about your respective constituents. And so I may use the terms client versus patient interchangeably, but for some organizations it might be a participant or a consumer or a recipient. So we want to just encourage you to think about your respective agency, the population that you serve, as well as the appropriate terminology that's used to serve the people that you currently work with. So in moving forward, just a quick overview. One thing that we talked about in our previous presentation that we kind of want to just bring everyone up to speed on is, why do we use telebehavioral health? Why is there a need for it? And so each agency has to look within their respective organization and begin identifying what are barriers to service delivery. What are some barriers to accessing care for services? And we want you to kind of think a little bit more about that as we proceed and go through the discussion today. So each agency, each recipient, each person needs to kind of look at, why do we need telebehavioral health services? Why is it something that we even need to think about? And that answer is addressed based on each agency, the location of the agency, and some of the different concerns that their recipients have identified as barriers to coming in to receive the services. We also want to consider health disparities as well as social determinants. And when we look at health disparities, we want to always consider the different health disparities that are impacting communities in Alabama. And we focus a lot on rural communities because of the limited amount of resources that can be accessed by those who are in need. And so mental health is considered one of Alabama's health disparities. And so when we look at mental health, we look at individuals who have been impacted by different types of mental health disorders, but also people who have been impacted and or diagnosed by substance use disorders as well. And so when we look at the mental health disorder, but also, the mental health disparity, but also substance use disorders, substance use can also be a social determinant that impacts a person's capacity to access care and access resources. So when we look at the justification of need and we look at those health disparities as well as the social determinants that impact, we also have to consider the lack of health professionals that are available to address the mental health disparity as well as substance use issues. So when we look at those health professional shortage areas, we primarily focus on geographic regions, counties within the state that have a shortage of behavioral health providers, okay? And for the purposes of this program, when we talk about behavioral health providers, we're specifically focusing on professionals as well as paraprofessionals who serve in a clinical and non-clinical capacity that address individuals that are impacted by mental health disorders, but also substance use disorders as well. So we want everyone to just kind of think a little bit more about that as we continue to set the tone for today's discussion. Another topic that we talked a little bit about in our previous program was about the different medians that individuals can use to provide telebehavioral health services. And so when we talk about the different medians, we're looking at how can these services be provided and what is the method in which they are provided. For example, we have behavioral health providers, to include clinical and non-clinical providers, that might use their desktop, they may use a laptop, they might use their tablet, and some might actually use a cell phone. And we will talk a little bit more about risk management considerations when utilizing the various medians, but we'll also talk a little bit more about the different disciplines and how we can assess both the provider as well as the constituent for fit with the different medians that are listed. Another consideration is when we talk about the different medians, we have to also consider the modalities that are used as well. So with each of the different medians that we talked about in the prior slide, these are some of the modalities. Individuals might engage in emailing, video conferencing, which is similar to what we're doing today, engaging with engaging through dialogue with a navigator or a consultant for services, and also self-help information lines, okay? And one, I specifically included a mental health support image for the National Suicide Prevention Lifeline, because this is an example of a self-help information line which is actually staffed by credentialed, experienced, and trained behavioral health providers to assist people who are experiencing suicidal ideations or having some type of crisis or mental health emergency. So anytime we are utilizing self-help information lines as a modality for the delivery of behavioral health services, we want to know a little bit about how that information line is staffed and what type of services that they are providing. But in addition to that, what that specific information line is not supposed to be used for as well. So just wanted to share a little bit with you about those modalities that are used with the different medians that we discussed. So one question that comes up quite frequently around the delivery of telebehavioral health services or telepsychiatry services or telemed services. And the terms are used interchangeably based on whatever the respective discipline is that's providing the service. But one universal commonality that all disciplines and agencies and people who are providing behavioral health services have to be concerned about is the technology issues related to some of the different components that we have listed here. We're not going to go in great detail, but we want to just mention them as a reminder of how we can make sure that we are compliant with the different aspects as it relates to technology. So one of the most important considerations that we have to think through and continue to have ongoing conversations about is the behavioral health service that is being provided, are we compliant with HIPAA laws? Are we compliant with HIPAA regulations? So you want to just continue to assess and reassess on a continuous basis to make sure that whatever service you are providing, you are compliant with HIPAA, especially when it comes to distance services. You want to also be conscientious around encryption with the delivery of information, but also receiving information, whether it be through a distance median or through manual services as well. Considerations as it relates to bandwidth is something that's very important, especially when we look at launching services in some of the more rural communities, more rural counties of the state that might not have as much bandwidth as some of the larger areas of the state. But also, when we look at the different equipment that services are being delivered from, we have to consider firewalls, okay? Does the equipment have firewalls? Is software in place to protect against viruses or potential hackers that might try to get into a session or interfere with any type of services? Other considerations that we have to also talk through and at least think about is the capacity of the camera that is being used on whatever type of medium is used for the service, but also the microphone and the clarity of the microphone in addition to the camera. We also want to think about computer security as well, being able to access information on a secure device and making sure that the device has security methods in place. And one thing that we always tend to have ongoing discussions about is, you know, when there are issues pertaining to the use of technology, how much of it is equipment error versus user error. And that's something I think we all also need to kind of take into consideration and have more dialogue about, especially when it comes to training. So when we look at some of the technology considerations, these are things that have to continue to be revisited and evaluated throughout the course of the delivery of telebehavioral health services, but also during the initial setup, during the program planning, the program implementation, but also post-evaluation and post-service delivery as well. One thing that we talked a little bit about was where are telebehavioral health services provided? And it is defined differently based on the various organizations, their mission, their scope, the services that they offer. Considering this program is being implemented through the Alabama Department of Public Health, there are numerous satellite clinics that the department works with to launch telemed services. So think about your respective setting, because services can be offered through a rural health clinic or a rural community health center. It could also be offered in a residential setting. We also look at community agency settings when we look at different social service organizations as well as community-based organizations, and sometimes faith-based organizations can be integrated as a delivery location as well. One location that is significantly used for telebehavioral health services is through military installations for people who are deployed or serving in sites away from their primary site, so to speak. And also looking at services that are provided through detention or correctional facilities, okay? So these are just a few examples that I think is very important to mention. However, once again, consider your respective agency and the location and who you are trying to serve. But also the most important thing is through telebehavioral health services, we're trying to minimize barriers that impact a person's capacity to access services and receive care. Okay, so let's talk a little bit about some of the different clinical disciplines of telebehavioral health services. Now, as I mentioned in one of the previous slides, but also in our Part 1 program that we did, there are numerous disciplines that are involved in the delivery of some of the different services. So in listing these, we want you to kind of think a little bit more about your respective role, your agency. Now, this list is not intended to leave any particular discipline out, but we're looking at telebehavioral health services, okay, and some of the different disciplines that are a part of the behavioral health culture. And once again, as it relates to people that have different types of mental health disorders, people that have substance use disorders, but also we have to consider individuals that might have different types of functional and access needs that require specialized care, that require specialized services, and require different types of accommodations as identified through the Americans with Disabilities Act. So in looking at some of the different disciplines, we have therapists, we have social workers, alcohol and drug treatment counselors, mental health counselors, psychiatrists, psychiatric nurses, as well as nurse practitioners. Now, with that being stated, we have different types of disciplines who receive specialized training to provide behavioral health services. So there might be other disciplines who have received training, who have attended continuing education workshops, and who have been equipped to provide these services as well. So we want you to consider those other disciplines that may touch on behavioral health, but it might not be their primary service that they provide as well. So as we move through this program, and just for the benefit and for the sake of time, we're going to primarily just focus on the first two disciplines. But what I want to do is encourage other disciplines to think about some of the different components that we address with therapists and social workers, and identify how that applies to you, but also allow it to give you some tips around what to pursue, what to think about, what to seek out additional information on as it relates to your respective discipline. So when we talk about licensed therapists, we're going to use this one just as an example. So when we look at licensed therapists, the national board that provides authorization and regulatory authority for licensed counselors to provide telebehavioral health services is the National Board of Certified Counselors, okay? And with that being stated, they have specifically created, just within the last year or so, a specific credential for licensed professional counselors to acquire in order to be certified, and that credential is the Board Certified Telemental Health Provider, okay? And so with that particular credential, it primarily means that a licensed professional counselor has received specific training in core competency areas to deliver behavioral health services through distance meetings. So that is one credential that is approved through the National Board of Certified Counselors. But in addition to that, NBCC has also come up with a set of standards that are specific to distance professional services. So that is just one example of a national regulatory entity that supports the delivery of telebehavioral health services for individuals who have been certified and credentialed through their respective board. So we want you to think about this from the perspective of your particular discipline and what your national association approves and regulates, but also what your state association approves and regulates as well. And we'll list some of those in future slides. The other example that we wanted to also emphasize is licensed social workers, which is also a behavioral health discipline for those social workers who work in a behavioral health capacity. Their state licensing board is, of course, is the Alabama State Board of Social Work Examiners. And I just listed just a few of the criteria that they require for social workers who are also delivering telemed services. And so once again, the terminology is used differently for each respective board. So once again, check in with your board so that you can make sure that you're using the terminology and practicing within the scope of how they outline this particular service. So through the Alabama State Board of Social Worker Examiners, for social workers who are interested in providing telebehavioral health services, they do have to have an active license to practice within the state. And they also have to be in good standing with the board and in compliance with professional standards of conduct. Now, those professional standards of conduct are specifically outlined by the Board of Social Work Examiners. So with each discipline that is involved with telebehavioral health services, you have to consult with your national and or your state board to know what their standards of practice and their standards of conduct, as well as what they require for the provision of services. So these are just two examples that we wanted to mention and talk a little bit about. There are a significant amount of other disciplines that fall under some of these same categories as well, but we want to encourage you to seek out that information through your respective discipline boards as well. So what are some of the telebehavioral health clinical services that can be offered through telebehavioral health? We look at screenings and assessments, and each agency has their own particular screening tool that they use based on maybe their funding source, based on the service that they provide, and just based on whatever the needs are of the person who's seeking those services. So you look at screenings and assessments. We also look at patient, client, and provider consultations, and sometimes those consultations are done just to assess and identify what the person actually needs from the agency. We also look at the provision of individual therapy as well as group therapy, and some levels of case management can also be provided, and in addition to that, the provision of referrals and linkages to care. Recognizing that not all services can be provided by one agency or by one person, but establishing a collaborative treatment team of internal and external providers where patients or clients can be referred to and also linked to care. So these are just some general services that are offered within the behavioral health culture, but can also be delivered through telebehavioral health methods. So now that we've talked a little bit about the different disciplines, some of the criteria for those disciplines and the regulatory entities that are involved, in addition to the clinical services that are often provided, we want to now talk a little bit about how to assess patients and clients and providers for fit. And one way that we look at that is through a self-assessment. Through a self-assessment and the capacity to be compliant, especially as it relates to security, privacy, as well as confidentiality. So what we're going to do as we proceed, we want to set the stage and encourage our viewers to think about their respective discipline, but self-assess their capacity and if they are fit, first and foremost, as it relates to technology, okay? As it relates to technology and what has to be taken into consideration, not just on the provider's end, but we also want to look at the considerations for the recipient. And in this case, it would be the patient or the client, okay? So in looking at those technology standards, a couple of things we want to just kind of talk through. We have to make sure that whatever medium we're actually utilizing or the modality that we're utilizing, we have to ensure that the electronic means is in compliant with current regulatory standards, okay? And so when we say compliant with regulatory standards, we're primarily talking about HIPAA, but once again, you have to look at the regulations and the standard operating procedures of your discipline, but also the agency in which you're providing services, okay? So the provider needs to be in tune, up to speed, and fully aware of those regulatory standards for their respective agency as well as the state. Use encryption security for all digital technology communications that are being utilized for therapeutic services. So you want to make sure that whatever medium you're using, you have encryption software installed on that particular medium to protect confidential information. We also have to look at whether or not there is a mutual understanding between the provider as well as the constituent around compliance with HIPAA standards for privacy and confidentiality, but also looking at what are some of the barriers and making sure that there is a full and thorough understanding of that. So when we look at assessing for fit, we have to make sure that not only the provider is knowledgeable and capable of explaining the technological issues that go along with it, but also making sure that the recipient has a good understanding of those technology issues as well. We also have to assess and make sure that there is an availability of secure backup communications that could potentially occur due to issues around connectivity with devices, but also the possibility of disconnect in the middle of a therapeutic session or an intervention or whatever the behavioral health service is that's being provided. When we look at technology, we have to consider every aspect that goes along with it. And specifically in this case, we're looking at connectivity, but also being mindful of the possibility that devices can disconnect in the middle of service delivery as well. When we look at additional standards for assessing providers for fit, and once again, this is across disciplines, we have to assess whether the provider has been trained to provide distance services. And when we look at if they have been trained to provide distance services, it all goes back to their licensing board or their respective certification board and what some of those continuing education requirements are. And we'll talk a little bit more about that towards the end of the discussion. We also have to look at whether or not the provider and the patient or the client knows how to use the preferred method of technology, but we'll take that a step further, making sure that both individuals are in agreement with the preferred method of technology, okay? Because some people might be more familiar using a laptop. Someone else might be more familiar with using a tablet. Some people might even prefer a cell phone. But whatever the preferred method is, we also always have to make sure that HIPAA is, we're compliant with HIPAA with whatever the method is used. We also have to explore and have discussions around the warnings associated with potential compromises of entering private information using a public computer that might be on a shared network. That tends to happen from time to time, and there are often circumstances and situations when people may or may not know that they are on a shared network, and that's something that has to be discussed and disclosed earlier on, especially with the constituents, so that they know some of the potential barriers and downfalls to that. Warnings around the use of auto-remembered usernames and passwords. We often use auto-remembered usernames and passwords for convenience, so that we don't have to keep up with so many usernames and passwords, which is a great thing. However, there's some considerations with that when we look at utilizing different medians for various services. We want to always advise against the use of social media, especially public social media. As we mentioned in our previous program, that social media is discouraged for the use of telebehavioral health services due to the lack of security around PHI, patient health information, using online methods. So we have to avoid tweeting, as well as communicating information through the use of blogs between provider and patients. And I want to stop for a second and just emphasize that several licensing and certification boards have regulatory policies and procedures around the use of social media with their respective disciplines. So once again, when we say assessing for fit across disciplines, I want to encourage everyone to check in with their respective accrediting entity for their policies around the use of social media overall, but also be very familiar with their policies around social media as it relates to the delivery of telebehavioral health services. Clinical considerations. Clinical considerations as we continue to assess for fit. Now we're transitioning into assessing patients and providers for therapeutic fit. The previous slides we talked about technology considerations, but now we're looking at clinical considerations and how we are to assess for therapeutic fit. So one thing that is always encouraged prior to the delivery of telebehavioral health services is that all initial sessions, all initial encounters should be conducted face-to-face. Methods of verifying mutual identities when using non-visual mediums should be discussed in that initial face-to-face session. And one reason we emphasize that is to make sure that we are compliant with HIPAA around security and confidentiality. So you want to make sure when using a non-visual method, you're communicating with the person that you're supposed to be communicating with. And sometimes there is a password or a code or the use of a photo. Something is identified between the provider and the constituent during that initial session that will help the two of them to assure and determine that they're speaking with who they need to speak with if they are using non-visual methods in the future. Another consideration during that initial session is just the determination of the location where distance services will actually be provided. And one example of that might be for a provider, that individual might be providing services directly from their office space. It's a good idea for the recipient to have had a visual of that provider's office space from that initial session, so that when they participate in future distance sessions, they not only recognize the person, but they also know that they are in the exact space that they're supposed to be in for that particular service. The same thing has to be assessed and identified in terms of where the patient is going to receive services, to make sure that there are certain considerations in place. So when we look at location appropriateness for both the provider as well as the constituent, we always have to, once again, take into consideration safety issues and security issues. One example of that I want to make sure I emphasize is that if we observe and we notice that a patient or a client is about to engage in a telebehavioral health encounter or a session from a vehicle or the car, and it was not initially stated that that might be a particular location that they will be assessing services, the first thing we want to make sure that they are aware of is the safety issue, and that they're not driving while they're in the middle of a session. So that is a number one safety issue to take into consideration, but also to take it a step further to just discourage them from participating in a therapeutic intervention while they're driving behind the wheel. So we look at safety and security, but we also have to consider privacy and confidentiality of their respective venue, but they're also their capacity to access support services if needed, and accessing those support services immediately. One important component of that initial face-to-face session is being able to document that particular person, that patient or that client, has a listing of support services, and having that information documented in their chart. But also, do they have immediate access to emergency resources if needed in the middle of a telebehavioral health session? That is something else that is discussed, reviewed, and documented during that initial first session. Because once again, keep in mind that even if services are provided at a distance within the same state, you might have the provider who's in one county of the state, and then you might have the patient or the constituent who's in another county of the state. So you want to make sure that that person in that particular county has access to support resources, but also emergency resources as well. We want to look at, is the physical location or the venue of the provider conducive to therapeutic services, especially when we look at home-based therapy. So in looking at home-based therapy, many patients, many clients, consumers, constituents, they might choose to receive services directly from their home, okay? But we have to consider, are they in a private environment? Because just because you're in the privacy of your own home, it does not mean that your own home is HIPAA compliant. So that is something that has to be assessed and looked at, and once again discussed in that first initial session. We also talk a lot about the visual background of the therapist. And when we look at the visual background of the therapist, it's good for the patient or the client to have a visual description of the therapist's office. But in addition to that, that provider has to be conscientious of what is in their particular background. So we have to take into consideration what is the big visual background of the camera. And when we say of the camera, we're looking at the desktop or the laptop, and how is that camera angled, okay? And so in providing services, no matter what the discipline is, you want to be conscientious of what the recipient is viewing behind the provider. So we want to make sure that the environment, the visual environment of distance services is supportive, okay? It is uplifting, it is encouraging, it is non-threatening. And so I listed just a few examples of that. So one example might be if you have someone who is receiving individual therapy for alcohol and drug use. And remember, they're receiving these services through distance meetings. So they are looking directly at the therapist through whatever screen that they're using. But we want to make sure that whoever they're working with, whoever that provider is, they don't have messages in the background that contradict the support that is trying to be offered. So if we have someone who we're trying to help minimize or modify their behaviors from alcohol and drug use, we don't want to have a poster in the background that clearly markets or advertises certain types of alcohol, okay? Or we don't want to have something in the background that promotes the use of certain types of tobacco products or other drug products. So we want to make sure that the background is supportive of the service that we're providing. In addition to that, we want to be conscientious of slogans and sayings. Oftentimes, you have people who are involved in behavioral health professions that might have different types of spiritual scriptures or spiritual sayings in the background. But you want to be conscientious of that, especially if the person that you are providing services to, they're not connected with a spiritual source, or they do not believe in a particular type of faith. So these are just some examples so that we can make sure that the service that we're providing is parallel, supportive, and conducive with the background of what the person actually sees behind us as well. Want to talk a little bit about risk management considerations. So we're going to talk a little bit about that as it relates to the medians that we discussed. So as we transition from assessing patients and clients and providers for fit, collectively, we're responsible for managing the risk factors that are associated with the use of different types of medians. So, as we mentioned earlier, we're primarily focusing on the use of a desktop, a laptop, a tablet, or a cell phone. So, when we look at those issues of concern, which is pretty common with the use of all of these different devices, we look at, for example, client notes, any type of clinical documentation. For example, it could be an initial assessment, it could be diagnostic information, it could be treatment plan, it could be progress notes, it could be encounters, anything that is pertaining to the patient and could have protected information, but also contact information. Those are some of the different issues of concern. So when we look at the risk factors that are associated with the different concerns pertaining to the different medians, we have to consider the fact that some of this data has the potential to be lost. It could be stolen, but it could also be viewed by other individuals and people who are using unsecured networks as well, okay? And we also have to take this into consideration when we might be using a network that's not secure. So that, once again, goes back to being mindful and conscientious of the different technology considerations that we talked a little bit about earlier. Risk management solutions as it relates to the desktop, the laptop, as well as the tablet. Protecting access with a unique password. Some of us work in a capacity where with the different laptops and desktops that we use, we have to change our password every 90 days. Well, that's for a reason. Those are some solutions that we want to take into consideration when we're providing distance services as well. Using a firewall or Norton antivirus type of program or software to protect your device. Not sharing your device with another individual when you're currently logged in using a type of telebehavioral software. Okay, so if you're in the process of utilizing therapeutic software to provide services, not sharing your computer or your laptop or anything like that when you're in the middle of a session. That might sound a bit questionable, but it's something that we do want to make sure that we mention. But also setting the device to receive and have routine as well as automatic software updates. Most of us are familiar with that because it happens quite frequently on our desktops as well as our laptops, but you want to make sure that whatever device you're using, it does have those software updates. Okay. We want to also make sure that there are no other browsers open when you're currently logged into a session with a potential client or constituent. You want to also set timers for the user to have to sign back in after 10 minutes of idle time or time has lapsed, but also making sure that there is no client information stored on the screen that is being used as well. When we look at a cell phone, couple of risk management considerations. You want to make sure that you don't have any client information stored within the cell phone device. You want to also protect access to your cell phone with a unique lock. A unique lock. And I emphasize that because oftentimes we say a unique password, which is a consideration, but also it might be a specific code that has to be entered or a specific type of swipe that has to be done in order to access that particular cell phone. But also utilizing security software in the initial setup and also having automatic updates that take place with the use of a cell phone. We also have to look at storage devices, hard drives and flash drives as a part of that risk management planning. Always consider using it in most behavioral health disciplines as well as clinical and non-clinical disciplines. We have to utilize the EMR or the EHR, electronic medical record, or the electronic health record, but also looking at the importance of backing up information on an external encrypted hard drive and secured in a safe location. Question often comes up from time to time about different types of encryption options, and this is why it's so important to have these conversations in the initial planning stage of providing telebehavioral health services, especially when it comes to the technology component, looking at a BitLocker for Windows, TrueCrypt, as well as File Vault for Macintosh computer. I can't give a lot of details on these different encryption options, but just want to emphasize them, and you can also look them up, but also talk with someone who is actively engaged in information technology who can give you more information about that. And that is the reason why we wanted to make sure we emphasize the importance of consulting with your IT department in the initial planning stages, in the consultation stages, but also implementation and just having ongoing monitoring. Having a representative from your information technology department is going to be crucial to the success of providing telebehavioral health services. So as we begin to slowly start wrapping up, when we look at the different disciplines who are providing the services, as well as risk management considerations, all of those components fit into how we assess for provider fit to deliver the services, but also how we assess patient-client fit to receive the services. Because a lot of what we've talked about, there has to be a mutual level of understanding from both perspectives around the use of technology and the clinical components that go along with that when we're talking about providing telebehavioral health services. So I want to start wrapping up by sharing some additional information with you that was mentioned earlier around licensing and credentialing. There are numerous boards out there state level boards, but also national boards, and that regulate the various disciplines that provide telebehavioral health services. So a few of them which are listed include the Alabama Board of Examiners in Counseling, the Alabama Board of Social Work Examiners, the American Psychological Association, the Alabama Board of Nursing, and I specifically listed the Alabama Alcohol and Drug Abuse Association because of our experiences in working with people who have been impacted by alcohol and drug use. And they are providing more and more information around how different types of clinical and non-clinical providers can deliver alcohol and drug services through telebehavioral health medians, as well as all of the other boards that are listed. Now, once again, this is not inclusive of every board, but we just wanted to list a few of them and want to once again encourage you to check in with your respective national and or state board to find out more about what their stance is. A couple of considerations for all disciplines to consider is you want to stay abreast of board policies and board procedures as it relates to distance services. You want to always attend and take advantage of content-specific training as well as certifications that are available around telebehavioral health services. And I repeatedly use the term telebehavioral health because that is the terminology that is used in behavioral health. But once again, it could also be considered as telemed, telehealth, telepsychiatry, telepharmacy. So these terms are used interchangeably based on the discipline who is providing the service. When we look at continuing education and professional development, each entity will provide insight around what's needed to stay abreast around their regulatory policies. So for some of the different boards that were listed, you have requirements that participants, for providers who are offering telebehavioral health services, they participate in annual trainings around HIPAA and being HIPAA compliant for the use of telemental health services. Different disciplines are required to attend annually a training on crisis planning and protocols that are used when delivering telemental health services, but also learning more about the various settings that these services can be offered and how to productively and progressively coordinate clinical care between multiple disciplines. Okay, so these are just some examples of continuing education that is required annually for some of the different disciplines that are providing telebehavioral health services. One thing I do want to mention, which I think is, I know is very, very, very important, is being knowledgeable about regulations and reciprocity laws pertaining to practicing across state lines. Not all regulatory entities approve or authorize for the various disciplines to practice across state lines. So you want to know what those legal regulations are. You want to keep up with policies that are in place that are advocating for the capacity for disciplines to practice across state lines and what the stance is on that before you begin to provide those services. Different disciplines have different procedures, different policies, different stances, so you want to connect with those particular entities prior to engaging in any type of service delivery. As we wrap up, I wanted to just give you some additional information of where you can read more and capture additional insight around some of the different considerations that we've talked about throughout the course of the program. You have the American Telemedicine Resource Center, Southeastern Telemedicine Resource Center, which covers Alabama, Georgia, Florida, as well as South Carolina. And I want to just kind of make a quick emphasis that this particular resource provides a lot of training information. They host an annual conference in one of the respective states where all they do is talk about different aspects and programs as it relates to telemedicine. And also the last one that's listed is adopting telemedicine in practice. And it just kind of gives some basic steps, some basic tips as to how to integrate telehealth, telemedicine, telebehavioral health within your respective entity, your agency, or your practice. These additional slides are just references and acknowledgments, places where you can get some really, really good information from to further expand your knowledge and further develop your scope of practice as it relates to telebehavioral health. And this information is listed on the slides. And the last thing is just my contact information. So if you're interested in learning more about what we have discussed and talked about today, you can feel free to email me. I would be happy to share additional information with you. And if you're interested in having a training on telebehavioral health, that is something that we can assist with coordinating and facilitating as well. And the last thing that I do want to remind everyone of is next month we will continue our discussion on telebehavioral health. So our very first program was just a general overview of what telebehavioral health is all about. Today's program was all about assessing providers and patients for fit and looking at those risk management considerations and the different regulatory issues that have to be considered. But when we reconvene on Wednesday, December the 18th, we will talk more about evidence-based practices in clinical therapy and what that actually means, because as we're delivering services, especially for state agencies, community-based organizations that are the recipients of federal resources, we have to make sure that anything that we provide, it is based on an evidence-based practice. And so we have started the process and penning to paper some of the different therapeutic approaches that are evidence-based that we will share more with you in detail at our next training. So thank you so much for this opportunity. We hope that you've gained something from today's program, and I'm going to shift the finality of this conference over to Brandon.
Thank you, Elena. I see that we don't have any questions via email, but I did have one question I wanted to ask. What are some possible training opportunities for individuals who are interested in knowing more about telebehavioral health?
Great question. So when we look at training opportunities, one thing that I will emphasize is the importance of checking in with your, if you have a license or a certification, check in with your respective state board. If they require for you to have continuing education, what we're seeing is that as different disciplines are embracing telebehavioral health and telemedicine, they're also providing trainings on these different topics. So the first thing I would say is check in with your respective state board or licensing entity to see what they have available. The second thing that I would also suggest is for pretty much all disciplines, we have to have annual training in HIPAA, but also annual training in ethics. And what I have found, especially over the last several years, is that there are several HIPAA trainings as well as ethics trainings that have included a component on how to provide services through distance methods and distance medians. So that is another one. It might not necessarily be publicized or advertised as telehealth or telemed or telebehavioral health, but when you see an ethics training or a HIPAA training, pay close attention to the objectives, okay, and see what is offered. But what I have seen is that there are quite a few ethics trainings and HIPAA trainings that are integrating that information. Also pay attention to different uses of terminology, okay, because different disciplines use different terminology when they're advertising and marketing different types of training. Another resource would also be the Telehealth Institute. You can go to their website. They offer trainings online. They also offer face-to-face trainings. Agencies can also contact them to bring a training to their respective staff on site. So there are a lot of resources out there. And one that I also want to mention is the Southeastern Telemedicine Resource Center. They also provide a lot of training as well. As I mentioned in a previous slide, that they do host an annual training in one of their states on an annual basis. So those are just a few options for consideration for people who are interested in being further trained.
Thank you again, Elena.
You're welcome.
This concludes our program for today, but I want to thank Elena for being here and thank you for watching. Please remember that you can refer back to the training and resources anytime on demand. Have a great day.